Here's to your health, brought to you by Coliseum Health System. Close to 500,000 total hip and knee replacements take place each year in America. To explain the surgery, here's Dr. Wood Pope.
So when we do a knee replacement, what we do is we basically remove the damaged portion of the joint. So we go in and we make 5 cuts on the end of the distal thigh bone, and then we make one single flat cut across the top of the shin bone, and we cement in 2 metal components, and then a piece of polyethylene plastic goes between the 2 metal pieces, and that gives you a nice smooth joint surface to articulate and allows your knee to bend without significant pain. We also take the back side of the kneecap and take off about 50% of the kneecap and cement a plastic component that tracks on this metal component here and gives you a nice gliding surface. And so you basically, in essence, remove a rough, painful surface and replace it with metal and plastic that allows pain-free motion. With the hip, we do essentially the same principle. We take out the damaged portion of the socket, the hip socket, and the damaged portion of the femoral head and replace it with a metal component that actually goes down into the thigh bone. And typically those are wedged into the bone and the bone will grow into the implant. Occasionally we'll actually cement this implant into place, but we're tending not to do that much anymore. And then we have either a metal or a ceramic head that articulates with a plastic liner that fits into a metal cup. And that again gives you a new joint surface that allows normal hip range of motion without significant pain.
The surgery has a remarkable long-term success rate.
They're doing more than they expected. They're having less pain than they expect 2 to 3 months down the road. And so long-term outcomes are excellent. The implants we're using are as technologically advanced as we've ever seen, and they just keep getting better. And some of the implants that we were developed and manufactured 10 to 15 years ago have a 95 to 98% success rate at 10 to 15 years out. And so those are implants that are 15 to 20 years old, and we expect our implants that we're putting in now to be even better than the ones we put in back then. So I would venture to say, 95% plus success rate at 15 years, which is pretty amazing.
Thank you for watching Here's to Your Health, brought to you by Coliseum Health System.